I'm really excited to speak to you today. I spend my days talking to local authorities about family hub policy and how they're implementing it, how they're reacting to it, what impact it's having in their area. So it's a great opportunity to update you on what's going on. We are seeing councils across England developing family hub plans, from Cornwall to Cumbria, from South Tyneside to Suffolk. It's very exciting to see what's going on. In my role, as part of the Family Hubs network, we help councils grasp the vision and the opportunity. And so this does give us an excellent vantage point from which to see how they're reacting and what they're doing with this opportunity. So you won't be surprised to hear that councils are very much welcoming government funding. They are very happy to be able to have money to spend on services to support families, to give younger children the best start for life. But what you're less likely to be aware of is the wider impact that Family Hubs policy is having on councils. Significantly, this includes councils that have not been eligible for the first wave of funding, yet they too are introducing a family hub approach. So what's going on? Why are they jumping up and down when they're not being given any money to do it? What we're finding is that many councils have seized on the family hub concept with both hands, because of the opportunity it presents to transform how they help families through working together better, through that joined up approach. And it's this thinking which is making a massive difference on the ground. I've spoken during my time talking to local authorities with family support workers and early years practitioners, and they sometimes confide that when demand is very high and capacity feels stretched, it can be very tempting to pull up the drawbridge and avoid collaborating with other sectors and teams, to say, I'm really sorry, we just don't have the capacity to work with you. But a family hub approach turns this on its head, asserting that greater collaboration actually increases capacity and cost effectiveness, as well as getting better outcomes for children and families. And this isn't just a theory. It's a proven approach demonstrated by innovating councils such as Essex, Doncaster, the Isle of Wight, and not far from here, Salford, who've been working this way for at least 5 years. So although the funding is new, the way of working is not. And we are only a couple of years into this new approach, and it's going to take time to really reach the potential that it offers. Many councils are therefore really energised and embracing not only the system change that they're being encouraged to take on, but the wider cultural change that's so important for cross-sector partners to come together. And I think rather than delving into that in great detail here, I'd sum it up in the way that Essex do when they say it's services without walls. A culture which prioritises supporting families to overcome their problems, where practitioners focus on meeting the need, not just thinking, well, what services can I offer, but actually thinking, well, I know someone else who can perhaps help here. Asking the question, if not me, then who? So, what innovations are we seeing? I can tell you that we can see quite a few local authorities thinking outside the box. How can we connect up, join up with other services around us to make a difference? So I'm just going to talk you through a few examples. So, for example, in Hillingdon, in the London Borough of Hillingdon, they were thinking, well, how can we actually create places where families can access help easily? We can't afford lots of new buildings and places to attract families. That's too much of an investment. But we have got a really good network of libraries where there are lots of activities going on for early years and older children, and the staff are really relational. They enjoy helping people and providing information and access to support. And so they've involved a whole network of libraries into their local family hub network so that families can go into a library and find out what's available to them. In Sefton, they were struggling to find out where were the families that needed help. We heard earlier about how some families just can be really difficult to help. They're scared, they're worried about being judged. How do we access those families? So in Sefton, they decided to build relationships with their primary and secondary schools and go into the schools to deliver programmes. This was a win-win for both the schools and Sefton Council and the families, because it meant that the council could identify those families that needed help and actually build the trust in the setting of the school where the families were happy to be. Then you've got Essex. The challenge in Essex was the massive demand for mental health services. And of course, that's not just Essex, is it? That's across the country. And they were thinking, well, how do we help support children and young people? They'd also got a large number of children who are persistently absent from school. And as you know, this is a big issue post-COVID. So what did they do? Well, the Family Hub staff were commissioned to actually deliver mental health support through the schools and actually go in and working with the school nurses to not just support the young people, but to actually coach the staff in how to work with those children, young people, to keep them in school. So providing a triangle of support with the parents and families and the schools. And then there's Suffolk. In Bury St Edmunds, they were struggling to get families to come into the children's centre. The parents at the local estate were very suspicious and they really didn't want to cross the threshold. But what they discovered was that there was a church, the Bridge Community Church, quite close to the estate, where they'd been working with these families for quite a few years. There was real trust there. The families loved going in. There were loads of good activities going on, and they were really happy to engage with the family worker there. And so the council and the church have worked together to build on those relationships. And the council is coming in to the church facilities to help engage with those families, to help those families get the help that they need. And lastly, we've got Salford, where they were really struggling, realising that lots of families had issues with their housing. You can try and solve all the other problems going on in a family, but if they're really unhappy and they can't work out how to cope with the housing system, what can they do? The early help workers there were struggling too. They were saying, well, we don't understand how housing works and we can't really find out what's going on and we don't know how to help. So what they did was they actually decided to develop their strategy of bringing the housing team into their early help work. And so now an early help housing worker is in their multi-agency working in their meetings and is also coming and just sitting in the early help team once a week so that they build those relationships. And the early help team is building their understanding of how housing works. So those are some examples of how joined up thinking is helping local councils actually solve the problems that they need to solve. And I think what I'd like to end on by saying is that I think we are well now on our way to winning the hearts and minds of the councils across the country, whatever their leadership, in realising the benefits that family hubs can bring them. But this is only the start, and we need to hang in there and build to make the most of all the opportunities that we have ahead of us.